Go.
All right, so I had the peroneal subluxation as my diagnosis. So the first thing that I want to do is palpate the peroneal tendon while the patient is going through active motions. What we're looking for is to make sure that the tendon actually stays behind the lateral malleoli. So I can come on this side, okay, and I can palpate. I would have done my layer palpation already. Okay. Then I'm going to have my patient, can you dorsiflex or bring your toes up towards your face? Good. Okay. And then come back down. Okay. Now I want you to bring the outside of your toes out. Perfect. Okay, good. Now I want you to bring your toes in. Good. And then I want you to plant down towards my hand. Perfect. Okay, and you can relax. Now to rule out any lateral instability that could be going on at the ankle, I'm going to do the anterior draw, but I'm going to modify it. So I'm going to actually bend the patient's leg. I'm going to place the calcaneus on the table. Okay, and I'm going to stabilize, and then I'm going to grab onto the tibia, and I'm going to provide a posterior translation. While I'm assessing the translation of the lateral malleoli, I'm also looking at the tendons, making sure that they're not subluxing. Okay. And if this test is positive, we can rule in lateral stability. If it's negative, we can rule it out. So I can place this back down. And finally, we could go through our series of manual muscle testing. The special test is the same as the manual muscle testing, so I'm gonna have my patient lie down on their left side. I'm gonna provide a series of counter eversion pressures while the patient is going through either dorsiflexion or plantar flexion. So I can stabilize here. I'm going to have the patient bring up this side of your foot up to the ceiling and hold. I'm going to provide that force. I'm looking for weakness, pain, or if this tendon starts to sublux and relax. Now I'm going to put you in a plantar flex position. Same thing. Come up for me. And then I'm going to give another force down, making sure and relax, making sure that this tendon stays behind the lateral malleoli. That's it.